Hi, and good afternoon, everybody. Welcome to May 19th, 2021 edition of our Licensed Independent Practitioner Collaborative webinar. I have that we are right at noon, so I'm going to go ahead and get us started for today. So, as always, welcome. We are glad that everybody is here, and I want to just take a second to introduce myself. I am Michelle Strobel. I am a PN trainer and a licensed clinical mental health counselor here at Partners Health Management. As a fellow LIP, it is an honor and a privilege to host and facilitate these quarterly webinars for you guys. I do want to just kind of do a couple of little quick housekeeping things. In the handout section of the GoToWebinar, you can see where I have put a copy of today's PowerPoint, as well as an updated resource list for you guys, and if any other session documents, but today I think it's just those two. So a recording will be made of this webinar, and we're going to upload it to the provider knowledge base. So if there's anything that you guys really liked or want to hear again, you'll have the opportunity to do that as well. Or if you have some colleagues that you know really needs to hear some of the information from today, the recording will be on our provider webinar, our provider knowledge base, so that you guys can get access to that. And that usually takes a week or so to get it up there. Quick reminder, we are in listen only mode. There is a couple of ways that you can ask questions, but we will not get to those questions today. Number one, you can put them in the question and answers box on your GoToWebinar toolbox. So you'll see one that says questions. If you'll pull that up, you can write any questions that you have. So that way, if you're going through the training and something pops up, either when one of our presenters are speaking, that way you don't forget it at the end. That's a way that you can do that. Please make sure you put it in the questions box and not the chat box. I'm not able to record the information in the chat box, so I may not be able to get you your answer. If you do put it in the questions box, just make sure that you identify yourself so that I can make sure and get the answer that you need. You always have the option to email questions to training@partnersbhm.org, and I will be more than glad to field those questions as well and get those answered and get you the answer as quickly as possible. We always do like to just say that a lot of the information that we share comes out through the provider knowledge based link, and I have the link up here for you guys, and of course this is also on your handout at the bottom. And we have our provider communication bulletins that comes out that you can subscribe to as well. This is a fantastic way to figure out like what's going on with the network, trainings that may be coming up, and all of that good stuff. So please make sure that you are checking out the provider knowledge base and that you have subscribed to the provider bulletin. And I believe the next provider bulletin comes out this week. So make sure you guys have subscribed to that. So without further ado, I'm going to show you our agenda for today. We do have quite a bit on our agenda. We have Summer here, who will be talking about our coordination of benefits. We have Beth, who will be who's part of our member engagement, and will be telling us a little bit about member engagement. And then I'm going to be going over some information about the ASAM trainings, some more standard plan stuff, and then additional resources, and talking about our Partners Training Academy. So that's what we have on the agenda today. And once again, just a reminder, this meeting runs from about 12 to around 1 o'clock. So hopefully you guys have a lunch and you're settled in for some good information. So without further ado, I'm going to go ahead and I'm going to turn it over to Summer.
Hi, my name is Summer Surratt. I am with Program Integrity for Partners Health Management, and I will be discussing today coordination of benefits. Partners Program Integrity Department helps improve lives and strengthen communities by ensuring our members receive the quality and level of care they need and are entitled to. that provider documentation demonstrates the need and care given, and that the taxpayer dollars are spent appropriately through rigorous detection and prevention of fraud, waste, and abuse. The coordination of benefits. For clinical coverage policy 8C, any provider services dual eligible beneficiaries shall be enrolled as a participating provider with each of the identified insurance carriers in order to be reimbursed. Partners claim adjudication policy states claims with coordination of benefits should be submitted within 180 days of service and include the COB information on the claim. If the member is currently enrolled in the Partners Alpha MCS system and obtains third-party coverage, or the provider is made aware of other party coverage, it's the provider responsibility. I'm going to repeat that again. It's the provider's responsibility to ensure this information is added to the system. On March 28, 2003, which was also revised May 22nd, 2018, the U.S. Department of Health and Human Services did provide a memorandum that provided information to the individuals that can handle Medicare payments for Part B mental health services. On page 7, those individuals are listed. You have a physician, a doctor of osteopathy, psychiatrist, clinical psychologists, clinical social workers, clinical nurse specialists, nurse practitioners, physician assistants, certified nurse midwives, independently practicing psychologists. All services provided to Medicare patients must be furnished by the practitioners, who is by virtue of the specific state licensure. And also, you must be impaneled with Medicare. And those individuals that are impaneled with Medicare have the rights to bill directly and collect and retain the fee for their service. Now, partners' responsibility. Federal and state regulations requires partners to be the payer of last resort. I'm going to repeat that one again. Federal and state regulations require partners to be the partner of last resort. Providers are required to collect all first and third party funds before submitting claims to the partners for reimbursement. Second bullet point, third parties payers, including Medicare and private health insurance carriers, must process the claim before partners does. Providers must report any payment or denial reason from third-party payers on claims filed with partners. Third bullet point. Partners pays coordination of benefit claims according to the lesser of the methodology. If the Medicaid allowed amount is more than the third-party amount, partners will pay the difference up to the contracted allowed amount. I'm going to repeat that again. Partners will pay the difference up to the contracted allowed amount. Last bullet point, partners will not pay for any service that could have been paid for Medicare or other private insurance plans. I'm going to repeat that one more time. Partners will not pay for any service that could have been paid for by Medicare or other private insurance plans. Partners will not reimburse providers for covered services provided by clinicians who are not impaneled. Partners will not reimburse providers for covered for covered services provided by clinicians who are not impaneled. If the provider does not have enrolled providers or impaneled staff with a primary payer, the member should be referred to an eligible provider of third-party covered service. I'm going to repeat that one more time. If the provider does not have enrolled providers or paneled staff with a primary payer, the member should be referred to an eligible provider for third-party covered services. Providers are required to collect, this is a summary I'm going to give you guys. Providers are required to collect all first and third party funds before submitting Medicaid claims to partners for reimbursement. Partners will not reimburse providers for covered services provided by clinicians who are not impaneled or not enrolled under recipient's third party coverage plans. This statement is so important. We did it twice. Partners will not reimburse providers for covered services provided by clinicians who are not impaneled or not enrolled under the recipient third-party coverage plans. If you have any additional questions, please contact Partners Account Specialist or Claims Department. The references used today was your Clinical Coverage Policy 8C, Partners Claim Adjudication Policy, and the U.S. Department of Health and Human Services, and the Centers for Medicare and Medicaid Services. And lastly, if you have any additional questions for me, my contact information is shown. And everyone have a good day. Thank you.
Thank you so much, Summer. We appreciate that. As LIPs, it's always super important to understand about our coordination of benefits and the processes that we need to make sure that we're getting paid for our services. So thank you for that, Summer. All right, moving on to our next agenda item. We have with us a member of our member engagement department, Beth.
Good afternoon, everyone. My name is Beth Brooks, and I am the Member Engagement Specialist Lead here at Partners. I'm very excited to join you today, and I just want to take a moment to thank Michelle for inviting me, and thank you all for letting me share information about our Member Engagement Department. Our Member Engagement team, our director is Allison Crotty, and again, I'm the Member Engagement Specialist Lead, and I covers Iredell, Surrey, and Yadkin counties. Then we also have Lindsay Green. She covers the Cleveland, Gaston, and Lincoln County areas. We also have Melissa Hatton, who covers Burke, Catawba, and Rutherford. We do have Shirley Moore. She is a Member Engagement Specialist and a CFAC liaison. She also helps Lindsay in the Cleveland, Gaston, and Lincoln area. And then new to our department is Laverne Currents. She is the Transition of Care Coordinator. She will help members transition in and out of standard and tailored plans. Then we also have Sharon Welling. She is our state funded waiting list coordinator. She will develop and maintain a state funded waiting list for services. This does not take the place of our registry of unmet needs for innovations waiver services, but she will help those members on our registry of unmet needs find services that they meet the criteria for. And we're also excited to have 2 more members of our member engagement added to our member engagement team that will cover Cabarrus and Union counties once they join Partners on September 1st. Member engagement roles, we do a lot of services for families and members. We help link members to available community resources, and we support members moving between health plans. We also, like I said, develop and maintain a state-funded waiting list. Our Member Engagement Department provides advocacy, supports, and education for our members and families who receive Medicaid and uninsured services. We also work with other departments to drive member initiatives. We work closely with our marketing and communications to provide member education, updates, and drive creation of member-specific materials. We answer inbound calls to the dedicated member engagement phone line, and also make outbound calls to our new enrollees. Our member engagement line that is available to assist members, providers, and stakeholders Monday through Friday, 8 a.m. to 5 p.m. Those who call after hours can leave a message and we will return calls by the next business day. Our number is 704-884-2729. And members can also reach out at memberquestions@partnersbhm.org. So we want members to have their voice heard and encourage them to call us. We also have a member portal, and members can also find us on social media. We do have a PICS Health mobile app. We have contracted with PICS Health. We encourage our members to register for this app. It monitors health and mental health between their services. Members can download this progressive web app to their mobile device by going to www.highpics.com. And through interacting with the Pixar, who is a sweet chat box, the member can access resources and receive helpful tips to live a healthier life. The PICS Health app focuses on daily mood and wellness check-ins, screenings, messages, and assistance as needed, either through their app or calling the Compassionate Call Center to chat with peers who have lived experience. The member engagement team also follows up on referrals made by members through their interactions with the PICS Health app. So if they have a social determinant of health needs, such as food or clothing, employment, any of those social determinants of health needs, we can link them to the community resources in their area that will help with that, with those needs. Also, we have our Member Connect, which is our member portal, and here members can register for seamless communication with partners and access up to updates and health information. And to find the Member Connect, you go to our partners website, partnersbhm.org/member-education #member portal. So they can also send and receive secured messages regarding their health plan and finding resources to also help with finding a provider and take screenings. So we very much encourage all of our members to get connected with the member portal, Member Connect. Next, I want to talk to you about our Member Cafe. Our Member Cafe is held on the second Tuesday of every month from 1 to 2. And this gives our member the opportunity to learn more about partners, their health plan, community resources, and the opportunity to ask questions or voice any concerns they have in a safe place. We try to make our guest or community highlight very relevant to what is helpful for members. For example, we've had members from the Autism Society and NAMI NC to come and speak about the resources that they also offer our members. So we encourage our members to come and join us. It's a safe place. They get lots of good information and are able to ask questions. And that is all I have today. And if you have any questions about our member engagement department, please field them to Michelle and we will get those answered and back to you. Thank you so much for your time and listening to me, and thank you, Michelle.
Thanks, Beth. You know, as LIPs, this is some really great information. A couple of things that come to me is, number one, I've been, for those of you guys who have been part of this LIP collaborative for several months, I've been the PICS app with you guys through the resource document that I send out. And the PICS app is absolutely amazing for the members that we serve, because it is definitely a way to kind of help keep them engaged in between sessions. And as LIPs, you guys know how important that is to keep people engaged and working on their wellness in between sessions. So The Pix app is absolutely amazing. I also really love this members cafe that we have just started doing, and I really commend our member engagement department for doing this. As an LIP, if I was serving partners members, I would try to find, like, even this slide. You've got a copy of the slides there, or you can go on the website and find this information, and just put a picture of this up on like a bulletin board in your office to share with members, because this is another way to get them engaged. So this is really awesome stuff that is coming through our partners member engagement department. So we appreciate that. All right, guys. So I'm going to go ahead and talk a little bit about ASAM training. And I know the information that I'm going to share with you guys today, actually the rest of the information I'm going to share with you today, is stuff that has kind of been on our radar for a while. But it's really important that you guys understand how important it is to have this training. So the ASAM training, the Division of Health and Benefits, North Carolina Medicaid, and the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services are actually offering a way right now for you guys to get the ASAM training. Now, this is coming through the project that's part of the 1115 Substance Use Disorder Demonstration Waiver and Implementation Plan. So when we think about that, what we know is going to happen with this plan is that it is going to require the use of the ASAM criteria to determine appropriate level of care required for our members. And it also is ensuring that direct enrolled professionals providing comprehensive clinical assessments and diagnostic assessments, that they have the ability, the skills, and the knowledge to make an ASAM level of care determination for beneficiaries with substance use disorder diagnosis, okay? And so I know when this ASAM training was rolling out, there was a lot of question about us LIPs and how this is going to impact us, because most of us do not do a whole lot of work with folks who have substance use disorder. And when somebody comes in with substance use disorder, if it's beyond our scope, we refer that out. What this 1115 substance use disorder demonstration waiver is now telling us is that if we as LIPs do comprehensive clinical assessments or diagnostic assessments for members who come through our door, and let's just say that we do discover that they have a substance use diagnosis, yes, we still will refer that out because it is out of our scope. However, we are responsible for doing an ASAM level of care determination on that folks, because that ASAM level of care needs to happen before we refer out. And the reasoning behind this is because we already know it is super hard for members to engage in the first place. And then when we do a intake and we automatically refer out, people get lost in that shuffle. And so this is what they're trying to do, is they're trying to make it easier on the member to continue to stay engaged in services. So everyone, from what our understanding is at this point, is every clinician who does this CCA or diagnostic assessment needs to be able to have the skills and the ability to do an ASAM level of care. So in preparation for that, the state has been offering this live training and this e-training through the Behavioral Health Springboard. And these two trainings, the live training is a 2-day skills training, and then the e-training, it looks like, I've not seen it get extended yet, but it looks like it's ending June 30th, which means you would have to have all your modules completed by June 30th. But the state is offering these trainings at a deeply, deeply discounted price, okay? So with the live training, they're offering this training for $90 per person. We've also been told from some of our other providers that if you send, I think it's 4 or 5 providers at once, so like if you have a group and you send all of your providers at one time, you get a discount even from then. I think it like might be buy 4 get 1 free or something like that. So you would need to look to inquire about that, but that is still a very deeply discounted training at $90. And you get the ASAM manual per person. So every clinician that you send will get the manual, and they were charging $15.50 per manual, which the manual itself is like $100. But the $15.50 was just to cover the shipping. Last I heard, they're actually covering the shipping now because they want everybody to get this training in. So this is really important, and I hope you're hearing me say this. We need to make sure that everybody is getting this training. What is it going to look like when the state stops offering this very discounted training? We don't know yet. The LME MCOs are working, trying to get that figured out, but we do not have guidance yet on what that's going to look like. So for right now, this live training is $90 and the e-training is $75, okay? And so it's super important that you guys are following this, because what we do know is if you do those comprehensive clinical assessments and you do those diagnostic assessments, that you are going to be required to know how to do an ASAM level of care determination. So let's talk a little bit about the upcoming changes in Medicaid, right? So we know that Medicaid managed care standard plans are starting to really get ramped up. Partners recently did a standard plan transition of care training in partnership with the state. That was done on April the 15th. The slides and the recording of that webinar are available on our Partners Training Academy and the training library. So if you have not had the opportunity to hear that training yet, please take a moment. I'm thinking, I can't remember exactly how long it is. I think it might be an hour and a half, something like that, when you count in the questions and answers. But please take a moment to at least review those slides and watch that recording if you can, because this transition to the standard plans is quickly coming upon us. So just to recap so that you guys can remember, is we do have 5 standard plans in North Carolina. We have WellCare, we have United Healthcare Community Plan, Healthy Blue, AmeriHealth, Caritas, and Carolina Complete Health. So these are the 5 standard plans that we have, and this is their website so that you can check them out. It is highly encouraged that every single one of you guys are credentialed with these plans, because we don't know what members are going to go with what plans. And if you want to continue serving Medicaid members, this is how you're going to do it, because the majority of Medicaid members will fall underneath this standard plan criteria. So it is super important that you guys are reaching out to these standard plans and making sure that you have contracts. There is also a plan for the Eastern Band of Cherokee Indians and what they are calling the tribal option. And so this is a separate plan that they're doing for the EBCI, so this tribal option. And so what we're looking for with the tribal plan is that the members living in a tribal service area who do not choose a health plan, okay? And so now open enrollment is what's going on right now. It was set to close, but they've extended it, and they've extended it to May 21st. So if members are living in the tribal service area and they do not choose a health plan by May 21st, they're automatically going to be enrolled in this tribal option. So if you are serving members that are in that tribal service area that are not choosing a health plan, you guys may want to pay attention to how to get credentialed with this tribal option as well. So open enrollment, like I said, is going on. And when we think about the open enrollment, it was set to have closed, I believe, on the 14th. They have now extended this to May 21st. So members have until May 21st to enroll in a health plan. If they do not enroll in a health plan, and they are what we are calling the standard plan eligible, if they have not done that by May 21st, they will be automatically enrolled in a health plan by North Carolina Medicaid. Okay, so that's why it's important that you guys contract with every one of them, because we don't know which, number one, which plan that a member may choose, or number two, if they are auto-enrolled, which one they're going to get auto-enrolled in. So the auto-enrollment process prioritizes existing relationships between beneficiaries and their primary care providers. And so what the auto-enrollment is going to try to do is look at, you know, where that member has been receiving services, and try to connect them with a plan that those providers are connected to. But they're doing this for the primary care. So that's why it's important that you guys are enrolling in all of these plans to be able to option to use these if you're going to want to do that. So what if the members that you are serving have questions and are calling you about who can I enroll with and that sort of thing? Of course, we can't tell a member which plans to enroll with. You can tell a member which plans that you are contracted with. So if they're calling you to ask which one of these plans are you going to be accepting, you can absolutely let them know that. But beneficiaries can enroll in a health plan by calling the North Carolina Medicaid enrollment broker, or going to ncmedicaidplans.gov. Okay, there is an app that they can download on their smartphones that will help them through this process as well. So the main thing for you guys to know is that even though the enrollment process has been transferred and extended until May 21st, this does not change the start date of Medicaid managed care from July 1st. So we still are looking at a start date of July 1st for our Medicaid managed care. If members call you wanting to know how to enroll, this is the information that you guys would want to provide to them. A North Carolina Medicaid enrollment broker is going to be the best way for a member to get their questions answered. We've seen some talk around about members contacting their local DSS and things like that. Those guys are not going to be as helpful as your enrollment brokers will be. So please, if you have members contacting you wanting to know how do they enroll in a plan, and what do the plans offer, the enrollment brokers are going to be the best thing for them, because that's what the enrollment brokers know. They know these plans, they know what each of these plans offer and who is contracted with these plans. So when your member calls them, or when the member's representative calls them, they can help walk them through, like, what physicians do you see, what specialists do you see, what are you looking for in a plan, because each of the plans actually offer some value added things that are very different. So WellCare is offering things differently than Healthy Blue. Some of them are offering like reading programs, some of them are offering like summer wellness things for children. So there's all kinds of different things that they're offering, and we can't know all of those things, but that's what the enrollment brokers do, so they can really help to guide the members into aligning themselves with the plan that works the best for them. So we are on the very fast track now to our standard plans going live. Like I said, standard plans will be going live July 1st of 2021. So that's right around the corner. So please make sure that you guys are contracted with the ones that you want to be contracted with to continue providing the excellent service that you provide. So we are on the downhill slide for today. We had a pretty kind of condensed agenda again today. So I definitely won't be keeping you all the way to 1 o'clock. But I do want to just talk about a couple of additional little things that may be of interest to you. The first one is information about county realignment. So as you guys know, we have had some counties that have inquired with us about realigning. Some have already been approved through the secretary, and we're in process of getting those collaborations going so that we can make those transitions very smoothly. This website, this is on our web page, our partners web page. And if you go to county realignment on the partners web page, it is going to have all the information that you need as we start looking at what is county realignment going to look like for us. So if you have questions about, serving people in those counties, or if you have coworkers who maybe work in counties that are coming on with realignment and they have questions about how to connect with us, this is how you would do it, is through our web page. Also, looking at Medicaid transformation, Partners also has a web page that is dedicated to the Medicaid transformation. So it has two different links to it. It has a member side and a provider side. And so this is where you can get all of your most current information about our Medicaid transformation. On the provider side, there is a frequently asked questions document on there that you can click on that talks about transition of care in between standard plan and tailored plan, and those frequently asked questions. So this is the website that you would want to look at for that. Of course, with every single one of these trainings, because I keep getting feedback that you love having this document, there is a resource list, and it is attached in your handouts. And it talks about, how to find trainings. It talks about partners publications, the Hope for NC hotline that is still currently going, any COVID-19 updates and things like that, Medicaid transformation, clinical coverage policies, and more. So the resource document is for you guys to keep. I do update that every month. I look at it to see if anything needs to be updated. Everything doesn't always get updated every month, but just know, like, the links don't always get updated, but sometimes when the links connect you to an outside source, those outside sources are getting updated. Like the COVID-19 links, some of those that go like to the CDC will have some of the most recent guidance from the CDC about COVID-19. Clinical coverage policies, there's a link in that one that talks about, clinical coverage policies that are up for public comment. And so, of course, I don't change the link because the link doesn't change, but what the state puts on that link changes from month to month. So even though the document may look the same monthly, if there are things that interest you on that document, it might be beneficial to go out and just take a look at some of those external links as well. So make sure you download it and that you have that available. So here's my shameless plug, right? I am a provider network training. Training is my passion. So Partners Training Academy is going to be your go-to for some great trainings that are coming up, okay? We have person-centered thinking coming up. We also have motivational interviewing that we're in the middle of right now. Something that is really exciting that is coming up that I can't even contain myself is a diversity training on racism and rap. So it's utilizing rap in session, and it's the trainer. He is amazing, and I'm really looking forward to that. Now, all of us are, clinicians, and we all have license, and we need to keep those licenses current and up to date. Please remember that all of Partners trainings are free, and most of our trainings offer CEs. So this is a good way to get some free CEs if you guys are needing it for licensure. So please check out Partners Training Academy. This is where you definitely, partnerstraining.org is where you go to find the calendar. It is also where you go to find anything that we've done in the past that we have permission to post. So those will be in the training library on this training page. So it's a great resource for you guys to check out. Also, if you have any questions or comments for the Training Academy, please feel free to email those to me at training@partnersbhm.org. If there's a specific training that you as a LIP needs or that you're looking for, things like that, I'm open to suggestions. I actually am working on our training plan for the next fiscal year. So if you guys have thoughts and ideas about what you would like to see in the training plan for next year, please email me and we'll see what we can do, because we want to make sure that we are meeting your needs as well as getting those trainings out there that, we have to as part of clinical service definitions. But we also want to make sure that we're getting the things to you that you want to see. So last but not least is my big thank you. Thank you so much for committing to me this hour once a quarter just to kind of go through and do some reviews of things that are coming up. Our next LIP webinar is scheduled for August 18th at noon. Please look for your registration link in the July provider bulletin. We will make sure and get that out so that you guys can go ahead and get registered and get it on your calendar. Because if you're like me, if you don't put it on the calendar, you're not going to make it. So thank you again. I appreciate every single one of you. Thank you for the hard work that you do, and we look forward to seeing you next quarter. If you have questions, please make sure you email them to me at training@partnersbhm.org, and I'll be more than glad to get those to you. This slideshow and web and recording will be posted to the provider knowledge base. Have yourselves a wonderful day. Thank you.